Hi, I'm Amy, and I'm going to talk to you today about automated dispensing cabinets, or ADCs. So, medication errors are a big patient safety concern in healthcare today. There are many factors that contribute to medication errors, and there are a lot of things that we can do to help prevent these errors from occurring. Automated dispensing cabinets are one of the potential solutions. They have a lot of security features and a lot of associated security features that can help to prevent medication errors or to at least bring the prevalence of medication errors down. This is just an example of the different medication errors that have occurred and what is some of the most common. So one example would be the wrong frequency or the wrong drug or medicine. And there are different features with automated dispensing cabinets that can help to prevent those problems or mismatch between the patient and the medication. And automated dispensing cabinets and their features can help prevent that as well. And I'll go into a little bit more detail in a little bit. So automated dispensing cabinets, a lot of us are pretty familiar with them already. This would be like a Pyxis system to dispense medications for patients. It provides convenient access to patient medications and a convenient way to store them. Usually they have other safety features built in, like temperature monitoring that's automatic and sends alerts to the pharmacy if a temperature regulated medication goes out of range. It's stocked and managed by the pharmacist and the pharmacy technicians, so they have a lot more control over the medications that are being distributed to patients. The nurses are the ones that remove the medications and distribute them to patients. So some of the safety features that go along with automated dispensing cabinets are barcode medication administration, which is when you scan the medication and you scan the patient's wristband to make sure that there's a match. There's also computerized prescriber order entry, or CPOE, and that is when the physician or the licensed practitioner puts the order into the computer, and then there are double checks that are built into the computer that will cross-match the medication and potential allergies or medication mismatches or medications that won't go together. The medications are locked and sorted, so it is much easier to keep track of high alert medications or medications that need to be counted and regulated, like morphine. And there is a pharmacist order confirmation. So every order that is put in gets reviewed and confirmed by the pharmacist before it is released so that the nurse can pull the medication out and give it to the patient. So it adds that extra check. There are some deviations from the safety practices associated with automated dispensing cabinets, and they can cause patient safety concerns. For example, withdrawing from multiple patients at one time. That defeats the purpose of having everything separated by patient. Distractions when withdrawing medications, because mistakes can be made or the wrong medication can be withdrawn from the wrong drawer in the dispensing cabinet. And overrides. Overrides are a big concern because you're pulling out a medication that is not for that patient or has not yet been approved. There are different ways to prevent these deviations from the safety practices. The number one thing that you hear very often is to put the dispensing cabinet in a quiet area that is free from distractions. And then when a nurse is there withdrawing medications for the patients, don't distract the nurse and make sure that he or she is focused on their task of pulling medications. Also educating about medication safety, because your staff will be more responsive to safety practices if they know that patient safety concerns can occur when they aren't paying attention. The use of computerized order entry for physicians adds that double check of the computer looking at the patient's allergies or cross-checking medications that the patient is on. And it also prevents any issues with handwriting, if the handwriting is illegible, or it'll double check that the order, the dosage, or the how often the patient is getting it is appropriate for that medication. The pharmacist then checks on the medication orders, so there's that second set of eyes from somebody who specializes in medications, and discouraging overrides of the automated dispensing cabinets. So the strategy to educate everybody is, first off, we need to talk about why it's a problem and make people aware of the problem at hand. And you can do that by gathering data on medication errors and overrides within the hospital, so you can show the staff data straight from them and in real time. And once they're aware of the problem, you need to educate everybody using multiple education formats, because everybody learns a little bit differently. Not everybody is going to retain information in the same way. So a few examples are using online learning, maybe a PowerPoint presentation on the web learning program that your facility uses, using hands-on learning. So bringing an automated dispensing cabinet in and teaching the staff on that cabinet and allowing them to play around with it in practice. And also visual learning, so lots of pictures and visual representations of what you're talking about for those visual learners in the group. There should be training upon hire and then annually, and re-education needs to be done as necessary. So you need to evaluate if the education is sticking and if anything needs to be readdressed in order to maintain competencies on that. The outcome measurement is to track the medication errors within the hospital and to track the automated dispensing cabinet overrides pre and post education to see if there's any improvement. One thing that the pharmacist can do is, if they are looking at the dispensing cabinet overrides, they can provide immediate intervention. So if they see an override, go up to the unit and talk to the nurse right then and there and see what happened, why was that override done, and what can we do in the future to prevent that override from occurring. And also following up on all overrides every time. So if in the moment education cannot be done, make sure that you follow up on those within 24 hours. Otherwise, the person that did the override may not remember what exactly was going on. The stakeholders are nursing. They're the ones that are pulling the medications and administering the medications to the patients. The pharmacists are the ones that are filling the automated dispensing cabinets and managing them, and then also following up on any overrides. And the physicians are the staff that are prescribing the medications and entering the orders. With Lewin's model of change, there are 3 steps: unfreezing, changing, and refreezing. So to unfreeze, you first need to create awareness that there's a problem, and that is by tracking medication errors and overrides and presenting that to the staff so that they know that there is something that needs to change. And then changing is when you do the staff education and implement the practice changes with the automated dispensing cabinets. And refreezing is when the new education is solidified as normal practice. And during the refreezing part, that's when you need to be extra vigilant about your monitoring so that you can follow up on any deviations right away. That way it gets really ingrained into the minds of the staff. The technology used would be the automated dispensing cabinets and all of the things that go along with it, like barcode scanning, online education tools, and electronic monitoring. And that's to monitor the overrides. Usually that's included with the automated dispensing cabinet, and medication errors, which would be tracked through the event reporting system. The impact on nursing is pretty strong because the nurses are the ones that are dispensing the medications and administering the medications. They can also help to identify any potential errors or problems with the dispensing cabinets, and their focus really is the safety of the patients. So this might change the way that they practice and the way that they administer medications to patients, but it has a significant impact on improving patient safety. So it has a significant impact on nursing because of that, because their primary focus is maintaining the safety of the patient. And these are my references. Thank you so much for listening.